Are you suffering from knee pain? Did you know that 1 in 4 Americans are actually suffering from knee pain every single day? Hi, my name is Dr. Cowan from Square One Health, and today I'm going to be talking to you about knee pain. One of the most common causes of knee pain is actually excessive weight. For every 1 pound that we have in our torso, that puts 4 additional pounds on each knee. So when it comes to treatments, losing just 1 pound of weight takes 4 pounds off the knees. Let's say you lose 10 pounds. That's going to take 40 pounds off your knees. Being overweight is one of the most common causes of knee pain because that puts a lot of excessive stress on those knees. This here is 5 pounds of fat, and 5 pounds of fat actually puts over 20 pounds of extra forces on those knees. So about 1 pound up through here adds 4 pounds onto those knees. So losing just 5 pounds of fat can take off essentially 20 pounds of pressure off of those knees. Taking that weight off your knees is going to help to decrease the rate of osteoarthritis, which is one of the most common causes of needing a knee replacement later down the line. Knee osteoarthritis is where there's excessive grinding in that joint from excessive pressure, inflammation, as well as altered biomechanics, or essentially the way that that knee is working or functioning. Another common cause of knee pain is flat-footedness. Flat-footedness is where we lose the arch in our feet. Our feet should typically have a really nice, good supported arch, which helps to absorb forces. That also helps to keep the knees in a more proper alignment. If we lose that, our knees start to cave in, and that starts to put a bunch of excessive load in through the knee. A common fix? For most people, we can actually use foot strengthening exercises to help to support that arch a little bit more naturally. But when we have such a severe loss of that arch or flat-footedness, sometimes we need a little bit more oomph to be able to help to support that arch. That's where a custom orthotic can come into play. A lot of custom orthotics are not actually custom. They take a general mold, they don't actually put an arch into your foot, and they don't move at all because they're made of either metal or plastic. What we do here at Square One Health is we take a custom 3D mold of your foot, and in that custom mold, we actually put the arch into your foot. So we mold your foot in the arch that your foot can support. So it's not going to be too little, it's not going to be too much, it's going to be that Goldilocks arch. And with these custom orthotics, they are movable, they are dynamic, because that arch should be dynamic. That's meant to absorb forces, kind of like a spring. So if we just have a solid arch that does not move, it's just not going to work as well. So custom orthotics are a very quick and effective way to help that knee pain because it's actually supporting down the kinetic chain. Normally, we should have a nice supported arch in the inside of our foot. That arch is going to help to support proper biofunction or biomechanical function inside the knee. Because as we lose that arch, naturally those feet are going to cave down and those knees are going to cave in. So if we are walking and climbing with our knees caved in, that's going to put a lot of excessive forces on the inside and the outside of the knee. So as we support that arch with either exercises or with a custom orthotic, that is going to help the knee track a lot better and much more efficiently with less pain. Now, like I was mentioning with the foot orthotics, really keeping a nice good arch, trying to prevent those knees from collapsing in, we also want to strengthen the hips, because if we don't have good hip activation or glute medius activation, which is an external or an outward rotator, then our knees are going to keep collapsing in. And if we're walking, running, going upstairs, that is going to put excessive load in through those knees, and that's going to start causing some pain. So a very easy exercise to do is called the clamshell. The clamshell is going to help to activate that glute medius. So activating that glute medius is going to ensure that we have good activation of external or outward rotation when we are doing an activity. Clamshells are a very effective way to target the glute medius muscle or the outside rotator to help to prevent that knee from caving in. Because if we do a squat and these muscles are weak, that knee is going to cave in. Versus if we have better activation through that hip, we can allow for a more proper activation and tracking of that knee. What you're gonna do is you're gonna lie on your side. Lying on your side is going to allow us to activate one side more than the other. I want you to place this knee, push it down into the ground, and while you push that down, you're going to lift that leg up, which is called abduction. And this is going to allow for good activation of that glute medius muscle. An alternative is doing a standing double clamshell using one of these bands. Placing that band around the upper knee is going to try to bring those knees in. So what we're gonna do is fight out using those muscles, and then we can perform a half squat. Keeping one leg out, now you're just gonna bring that in, bring it out, and we're gonna do some reps in through there. That's gonna get a really good activation of that glute medius. This is a great warm-up to do before you run, before you squat, and even before you go out on a run or a walk. You can even go right into that squat. We just want to avoid those knees caving in during that squat, so we really get good activation of that gluteus medius. If you're 1 in 4 people in America that's suffering from knee pain, let me tell you something, you don't have to live with that. So come to Square One Health, get a more thorough evaluation so we can see exactly where that knee pain is coming from, and let's help get you out of pain, back on that mountain, or back to running. If you like this video, subscribe below, give a like, and we'll see you back soon.